common for the fetus to die in the first trimester as a miscarriage. This can often be seen with abnormal bleeding and pain. It is important to determine this because continuing a pregnancy with a fetal demise increases the risk of infection. However, you can reassure patients that a subsequent pregnancy is usually normal. If you can see the fetus on ultrasound, you should be able to see cardiac activity. Look carefully for at least 2 to 3 minutes. If you are unsure about cardiac activity, get a second opinion from another trained health provider. If after close observation you see no cardiac activity, refer urgently to the referral hospital. Referral should be made no matter the gestational age. Here is the guideline again because it is so important. Refer urgently to the referral hospital if the fetus has no cardiac activity. Some pregnant patients with first trimester pain or bleeding have abnormal tissue in the uterus and no evidence of a gestational sac or a fetus. This can be due to an incomplete miscarriage, a molar pregnancy, or an ectopic pregnancy. Always refer patients with pain or bleeding and absent gestational sac and abnormal tissue in the uterus to the hospital immediately. In a complete miscarriage, the fetus and all gestational tissues have already passed out of the uterus. The woman will describe bleeding and passing tissues at home. Therefore, on ultrasound, the uterus appears empty in a completed miscarriage. Patients with a complete miscarriage do not need referral to the hospital. You can follow up clinically on your own. In an incomplete miscarriage, some placental and/or fetal tissue will remain in the uterus. A woman often experiences some pain and bleeding and possibly fever if it becomes infected. Because she might not even know she was pregnant, she may dismiss these symptoms as just a heavy period. On ultrasound, we can usually see a very thick and irregular endometrium or fluid in the endometrial cavity, but no gestational sac. A patient with an incomplete miscarriage needs to be referred immediately to the hospital because an infection may occur in the tissues retained in the uterus, which may make the patient very ill. We cannot tell from our images if there is infection in the uterus or not, so don't delay with a hospital referral. These images of an incomplete miscarriage show fluid centrally in the endometrial cavity. Notice that the fluid is complex, which means that it contains some echoes. The fluid is probably blood. The blue area is a prominent vein in a blood vessel scan. This is a topic we will not cover in this course. In this patient, the endometrium appears thick, probably from swelling and bleeding. The arrows point to the junction of the endometrium with the uterine muscle, or myometrium, to illustrate how thick the endometrium is here. Notice the echogenic material in the endometrial cavity on both sagittal and transverse images. There's also a small amount of fluid centrally in the image on the right. A molar pregnancy is a result of a conception with egg and sperm that doesn't develop normally. The cause is unknown. Although the fetus does not develop, the placenta grows rapidly and becomes covered with small cystic spaces that look like tiny grapes. Patients with a molar pregnancy often present with bleeding, nausea, or vomiting. On ultrasound, we can usually see an enlarged uterus, larger than estimated dates, and an echogenic mass in the uterus, which is the abnormal placenta that often contains many small cysts. This abnormal placental tissue must be removed from the uterus at a hospital, so refer these patients to the referral hospital immediately. Here is an ultrasound image of a molar pregnancy. We can see a uterus that contains several small cystic spaces in this image, which is typical of a molar pregnancy. Sometimes the placenta can have larger cysts, as we can see in this image, which is also consistent with a molar pregnancy. If you do not see a gestational sac, but see abnormal intrauterine contents, refer the patient urgently to the referral hospital. Abnormalities in the uterus include thick or irregular endometrium, and fluid in the uterus, often from an incomplete miscarriage, or a mass with cysts in the uterus, possibly a molar pregnancy. We will talk about free fluid and adnexal masses in the next lecture on ectopic pregnancy. Let's review the key points. Some patients with first trimester pelvic pain or vaginal bleeding have a normal intrauterine pregnancy. A normal intrauterine pregnancy is not confirmed unless there is a yolk sac or fetal pole. Other causes of pain or bleeding include blighted ovum, fetal demise, miscarriage, molar pregnancy, and ectopic pregnancy. Ectopic pregnancy, another important cause of first trimester pain and bleeding, will be discussed in the next lecture. Questions for review. Is pelvic pain or bleeding in the first trimester always a sign of something wrong? The answer is no. Bleeding and pain may occur in either a normal or abnormal pregnancy. What are the possible abnormal causes of pelvic pain and vaginal bleeding? The answer is that a blighted ovum, incomplete miscarriage, molar pregnancy, or ectopic pregnancy may cause pelvic pain and vaginal bleeding. Why is it bad for the mother to carry a fetal demise in her uterus for too long? The answer is that it may cause a serious infection. What if the mean sac diameter is 22 millimeters and no yolk sac is seen? Is this normal? The answer is that this is not normal and may be a blighted ovum or an ectopic pregnancy. What if the mean sac diameter is greater than 25 millimeters and no fetus is seen? What should you do? The answer is refer urgently to the hospital for obstetrician evaluation and repeat ultrasound. True or false? If you can see a fetus, you should also be able to see the heart beating. The answer is true. What is an incomplete miscarriage, and what will you see on ultrasound? The answer is that an incomplete miscarriage is a miscarriage with placental or fetal tissue remaining in the uterus. You should see thickened endometrium or fluid in the cavity and no gestational sac. What will you see on ultrasound if the patient has a molar pregnancy? The answer is a large uterus, an echogenic mass in the cavity, and many small cysts. Thank you for your attention and interest in learning pregnancy ultrasound.